Rivalida de Medicina de Puerto Rico, gram stain use and comparison to other stains. Clinical case-based question. A 45-year-old male presents with fever, chills, and productive cough with yellowish-green sputum for the past 3 days. On physical examination, he has tachypnea, crackles in the right lower lung, and increased tactile fremitus. The physician suspects pneumonia. A sputum sample is collected for gram stain and culture. Which of the following is the primary advantage of using gram stain compared to other stains like acid-fast stain or India ink stain in this case? A. Gram stain is specific for identifying Mycobacterium tuberculosis. B. Gram stain provides quick identification of bacterial morphology and guides initial therapy. C. Gram stain can detect fungi such as Cryptococcus neoformans. D. Gram stain is used to identify malaria parasites in blood smears. Correct answer, B. Gram stain provides quick identification of bacterial morphology and guides initial therapy. Explanation. Gram stain is one of the most widely used and rapid diagnostic tests in microbiology. It helps classify bacteria into 2 broad groups: gram-positive, purple, and gram-negative, pink, based on differences in their cell wall structure. The morphology, cocci or rods, and arrangement, clusters, chains, pairs, seen in the gram stain can help determine the appropriate antibiotics for empiric therapy. For example, in this case, if the gram stain reveals gram-positive cocci in clusters, this suggests a potential Staphylococcus aureus infection, while gram-negative diplococci may suggest Streptococcus pneumoniae or Haemophilus influenzae, guiding the choice of antibiotics. Why not the other options? A. Gram stain is specific for identifying Mycobacterium tuberculosis. Acid-fast stain, e.g. Zeal-Nielsen stain, is the appropriate method for identifying Mycobacterium tuberculosis, as it has a high lipid content in its cell wall that resists decolorization. Gram stain is not effective for identifying tuberculosis. C. Gram stain can detect fungi such as Cryptococcus neoformans. India ink stain is used for detecting Cryptococcus neoformans, a fungus, especially in CSF samples. Gram stain does not reliably detect fungi. D. Gram stain is used to identify malaria parasites in blood smears. Rickenstein stain is used to identify malaria parasites, Plasmodium species, in blood smears, not gram stain. Gram stain result will guide initial antibiotic therapy, e.g. broad-spectrum antibiotics for community-acquired pneumonia. Cultures should be sent for further bacterial identification and antibiotic sensitivity testing. Consider chest X-ray to confirm pneumonia and evaluate for complications such as abscess or pleural effusion. Would you like